nurses, and all other healthcare providers. I beg you, if you are not up to speed or do not have experience with a certain nursing skill or healthcare related skill, please know it's okay and go ask for help instead of jeopardizing patient care and patient outcomes, falsifying medical records, and most of all, harming your patient or not delivering care that your patient so desperately needs. Hello there. My name is Mary. I'd like to welcome you back to my channel, Motivate, where I hope that everything that I share with you from my own personal experience motivates you to do things differently today, tomorrow, or better yet, right now. In today's video, I really want to share something that happened to me that was absolutely mind-boggling. I was flabbergasted. I was beyond disbelief from a nurse or enduring being a patient in the care of a registered nurse. Now, I do not usually tell others, especially when I'm a patient, that I have over 20 years in nursing care experience and 13 years as a registered nurse with a variety of nursing experiences with a high focus on emergency nursing skills, emergency nursing care. So the other day, I went to an outpatient clinic where I was due for an intramuscular injection for a pretty expensive and pretty thick medication. Unfortunately, my nurse didn't know what she was doing, but I did not disclose to her that I was a nurse, and I just quietly observed her. So she prepped the medication, drew it up, you know, did all the initial procedures of setting up the medication properly, and it was time to give me a gluteal injection to my gluteus maximus to my butt because this medication is best practice given there because of the larger muscular surface area. So she has me stand and lean against the wall, and because I know what's going to happen, I take pressure off the side that she's going to give me the injection. She softly injects me, and I don't even move. And she said, "Oh no, you moved. I've got to do it again." I'm like, it's an intramuscular injection. If you do it right the first time, I mean, I don't say anything to her, but I'm thinking, did I mess up somewhere? But an IM injection, if you stab it right and inject it right the first time, there is no reason it should come out with literally minimal movement. She had not even gone to my subcutaneous. She was basically on my epidermis. I'm like, oh, stuff happens. So she's like, okay, we have to do it again. Next time, this round, I need you to be still. And in my mind, I'm thinking, I was basically still, but if you knew what you were doing, that was a jab, and the needle should have stayed in there, and you push the medication gently, and it should take a good 10, 15, or 20 seconds because it's a pretty thick medication. So she goes, takes out the needle that she attempted to inject me with the first time and attaches the second one and says, "Please try not to move." And of course, I listen and I tell her, "Oh, it's okay. Sorry if I moved." So she comes to the other side, and I softly kind of get my leg off the floor to get pressure off that leg to help ease the injection. And I can tell she's nervous, but all I'm thinking is, I know what's supposed to be going on. This should not be taking a second injection. So she stabs me gentle again and goes, oh my God, this medication is just so thick and it's building up at the tip and you keep moving. We're going to have to do it a third time. Come on, nurses. We all know for an IM injection, if injected properly in the first go, there is no reason a patient should be getting a second and third injection. But I know I need this medication. I know my own health, so I try to be relaxed and not attack her. But in my mind, I'm thinking, oh my God, what's going on? So she gets the needle the third time and now goes back to the first buttock that she tried to inject the first time. And I think by this time she was frustrated, flustered, and I'm still trying to keep my cool. And this is where internally I lost it, but I could not externally express it. But I think she was frustrated and was not going to keep this up. So she goes, boop, literally barely at the epidermis, just right at the very close subcutaneous, and goes, boop, 2 seconds. All done. I guess third time is a charm. I guess she did not know I have a lot of experience in giving intramuscular injections. And I remember thinking, I am so upset that she does not realize that I know that I did not get this intramuscular injection. And she says, all done. And in her glove, she holds my needle like this, concealing, sorry, literally like this, concealing the medication. Says, you're all done. You can go to the front and I'll meet you there. And I literally wanted to ask her, can I see that needle? Because I don't think you gave me the medication. But I realized, you know what? She might be having a stressful day. Something may be going on, or she's too much in herself to say, I have not done this enough because I do outpatient clinic and I don't do many injections, so I don't know what I'm doing. But instead, she says, you're all done. But in my mind, I know I did not get any of that medication 3 times. Third time was not a charm. Third time was a patient documentation falsification. And I leave, I check out, and we schedule my next appointment. But that night, you guys, I could not sleep. All I could run was, oh my God, I've been a nurse. How dare she do this? I did not get the medication. The doctor will probably expect that I'm finding the results of this. Responding. I'm responding to it. And I do not get it until another month away. But I could not sleep because, one, she has violated me as a patient. And I know she has falsified my healthcare records. So I really was conflicted on how to handle it, but all I could think of, what about the other patients that are in her care that do not know better, and this is what happens every month, but they're not getting better, yet they think they're getting the medication, and their doctor thinks they're getting the medication, but there are no results or positive outcomes from this pharmaceutical agent. So I guess reluctantly and with a heavy heart, I took it upon myself to request a meeting with her supervisor and express my concerns. And I sat for a long time with the supervisor and explained that I have been an RN for a long time. I've given a gazillion intramuscular injections. There are other many skills that I'm not well versed on because there are so many fields within nursing, from here to eyes to mouth to breast to all body parts have a nursing care attached to it. I know nothing about dialysis except the bare minimum that I learned in nursing school. I don't know much about labor and delivery because I have never done that. So I am very okay saying what my limitations are, but you put me in the ER, I have those down like the back of my hand. So once I spoke to the supervisor, she reached out to my doctor, and the very next day, my doctor called me, and I went over the whole story with her, and she decided that she was going to draw labs to test the medication levels, and lo and behold, it came back that it was non-therapeutic, and it was basically uh, not enough of what should the results should be in my blood plasma of what should have been if I had indeed received the injection. And I am due to get that injection sometime next week. But I do want to express, nurses, I know you have a lot on your plate. I know there are many areas that you are not well versed on, and that's all of healthcare. If you're a neurologist, you don't know anything about being a gynecologist. If you're a gynecologist, you don't know anything about being a nephrologist. But there's the book text stuff. So please, for the sake of your patient, for the sake of being a professional nurse, patient outcomes, proper documentation, and more than anything, the patient that desperately needs that medication, please just say you need help. You need to rehearse this skill with another nurse, or YouTube is an excellent source where every skill is basically on there, and you can do a few practice rounds before lying to a patient that they got their medication. All right, that's my rant and rub for today, and I thank you for watching. Please consider liking, commenting, and subscribing because I'm going to share more about nursing stuff, manifestation, law of attraction, meditation, mental health, and then some gambling. I hope you enjoyed this video. As always, if you have any questions, please feel free to comment down below, and I'd love to interact with each and every one of you. Thank you so much. Bye-bye. Bye-bye.